Hi, my name is Brett Franklin. I'm an orthopedic surgeon here at SportsMED in Huntsville, Alabama, specializing in sports medicine. I've been in private practice here for 10 years, and today we'd like to discuss meniscus tears or injuries to the meniscus cartilage in the knee. The meniscus tissue is cartilage found between the thigh bone or femur and the shin bone or tibia within the knee. You have two meniscus, one on the inside or medial meniscus and one on the outside or lateral meniscus. This meniscus tissue basically acts as a shock absorber within the knee and also provides some stability during certain activities. There are multiple types of meniscus tears, but basically we can divide them into two types. Acute tears, or an injury that happens either in sports or work or activities. The other type of meniscus tears that are extremely common we refer to as degenerative tears, which means they basically happen with activities as we get later in life. An acute meniscus tear often happens with sports-related activities, most frequently seen in high school or college-age athletes. Sports such as basketball, soccer, volleyball are very common sports which you'll find these injuries. Typically, these injuries will happen with some type of twisting activity to the knee. A patient may feel a pop or a catch or a tearing sensation as that happens, and usually there'll be a sudden onset or quick onset of pain. Symptoms of a meniscus tear or what patients may feel can vary. Again, with a young, athletic, acute onset tear, they may feel sudden catching, popping, or this swelling that will come on and making their knee feel stiff or even unstable to them at times. More chronic or degenerative type tears typically happen in patients 40, 50, 60 years of age, and oftentimes they won't recall a specific injury or something happening to the knee. Patients will often complain of stiffness or ache. They'll point to one side of the knee or other. There may be some swelling, and there may be catching, clicking, or popping that they feel. Patients may feel more pain when they're going from a seated to standing position, going up and down stairs, or bending, stooping, and kneeling when there's a meniscus tear. Typically, the evaluation for these injuries will begin with a standard exam and history by your physician. X-rays will typically be performed, and if need be, a MRI or magnetic resonance image will help us see in further detail the area of injury. There are multiple treatment options available for meniscus tears depending on the type of the tear and what type of patient we're seeing with these tears. Treatment may be as simple as activity modification, anti-inflammatory medications such as ibuprofen or Aleve. Oftentimes therapy, bracing, and a good strengthening program can help manage tears if they're more chronic or degenerative. For more sudden onset, acute type tears in young athletic patients, oftentimes the answer for those is going to be surgery. You want to try to get in there and repair that meniscus tissue because it's an important structure that protects the knee down life's road. Most oftentimes, surgery for meniscus tears is done all arthroscopic or in a minimally invasive fashion with just 2 or 3 small incisions around the knee. The goal for arthroscopic knee surgery for a meniscus tear is to try to repair the tissue if possible. You want to try to repair natural anatomy so that it continues to act as that natural shock absorber within the knee. Sometimes these tears are not fixable or they're too complex to repair, and in those situations we simply go in and remove or debride in a minimally invasive fashion the torn, damaged tissue. If surgery is required for a meniscus tear, the recovery time depends on what is actually done at the time of the procedure. Recovery for a meniscus debridement or removal of the meniscus tissue that's torn is very straightforward and relatively quick. Patients can begin putting weight on their knee typically as soon as their pain allows, over 3 to 7 days. They're moving their knee immediately, and oftentimes we have them in physical therapy within just a few days of surgery. Typical full recovery can be 3 to 4 weeks after removal or debridement of meniscus tissue. A meniscus repair surgery is a little longer recovery, In order to protect that tissue while it heals, patients need to be non-weight bearing or very limited weight bearing with crutches for about 4 to 6 weeks, and then they'll start putting weight on it, working on range of motion and strengthening, with anticipated full recovery over 3 to 4 months. To learn more about meniscus tears, please click or visit the links below. And if you think you may have some symptoms that you might feel be related to a meniscus tear or any knee problems at all, please feel free to contact us.